Hi everyone, my name is Tony Fox from Mrs. Fox's Plans. If you're new here, welcome, and if you're already a subscriber, thank you so much for coming back. So today I thought I would give you a little pain update. I haven't done this for a while. For those that are new here and don't know, I suffer from fibromyalgia, rheumatoid arthritis, complex regional pain syndrome, Sjogrens syndrome. I've had in excess of 40 operations. Several of those are major operations. I've had 3 major spinal operations. I've had both hips replaced. I've had both knees replaced. One knee I've had over 7 surgeries on, and it looks like I'm about to have another one. Shoulders have been done. Hands have been done a couple of times. To say I'm familiar with surgery is a bit of an understatement. So where am I at today? So I've been battling a rheumatoid, which was diagnosed after a car accident on the way home from work 29 years ago. And so the car accident is where I blew a disc in my back and I was pregnant. I had to have surgery, but I couldn't have it. I had to deliver my baby and waited a couple of years till he was a couple of years old, my youngest, Christopher. And then I had to have surgery. But because I'd left it so long, my body was so used to being in pain mode that it set off a whole gamut of other things. So the rheumatoid is the reason why I have a lot of trouble with my hands. I don't know if you've seen any of my videos, but you will notice that quite often I'll wear a hand brace, or I'll be complaining, or you'll hear pain in my voice. That's because I live with chronic pain every second of every minute of every hour. The intensity will change depending on what's going on. Right now I'm in a lot of pain, which you can probably tell from my voice. I've got a lot of drama with my hand. The knuckle here is moving and I'm getting shooting pains down my hand. I've got a lot of knee pain because I've got a cyst that's sitting on a nerve that we think we're going to have to do some surgery to. So it's just a never-ending story. It's just something. I go in and out of hospital having pain treatment. I have pain patches which I live with. I take narcotics for breakthrough pain several times a day, in some days not. So I basically live my life on the edge of how to make it more comfortable to live. I mean, does it get me down? Oh, absolutely. Are there days that I just think that I just don't think I can do this anymore? Absolutely. But the days, most of the time, it's my normal. I know what it's like to wake up in pain. I know what it's like to go to bed in pain. And I just have to keep pushing through. I have to keep living, because if you don't, then what am I going to do? What else can I do? I have a great team of doctors. I have a pain specialist which I see on a very regular basis. We work out, so it's January, so we will work out what my pain procedures will be for the year. We're just waiting on some information from my knee surgeon to see what they're going to do, because if he has to do surgery, that will bring my pain doctors will be there for that surgery, and they will have to take care of me after the surgery. While the surgery itself is a relatively minor procedure for normal people, for people that live with chronic pain, it can actually trigger lots of different things, a pain episode. So he will manage me afterwards. So if that's the case, then he will wait until he finds out when I'm going to have the surgery, and then we'll do our pain management program from that. So that's basically how we live. We actually have to try and manage things as best we can. I'm Australian, as you probably know by the accent. So in Australia, we have a federal healthcare system called Medicare. Medicare controls what the doctors can and can't do as far as treatments. They don't per se stop you. I also have private health insurance. They don't stop your doctors from treating you, but they certainly, when it comes to pain, people, they certainly limit your ability to get access to narcotics for the obvious reason. So you have to follow very strict guidelines. You have to have a mental health care assessment to make sure that you are not just a drug-seeking drug addict, because obviously they slip through the cracks. So there is a lot of procedures put in place to make sure that that's not what you are. And so whenever I need to get new scripts, they actually have to be recorded and registered and questioned and all of those things. So it's not just a go to the chemist, get your drugs and off you go. It's a bit of a process. And also my pain doctor will not keep increasing my narcotics because my body starts getting used to it. So how do we counteract that? I have ketamine infusions, which you probably would have seen a few videos ago. I did a vlog of my last ketamine infusion. Reasons we do that is to reset your pain medication back down to zero. It's the same as if somebody that is a drug addict, their body needs to be neutralized from the drugs. This is one of the drugs that will do that and will help do that and help manage that. So this is why we use this program. They give you ketamine over a week in hospital that is slowly ramped up to a maximum dose, and then you keep on that dose for a few days and then you're taken off it. And then about a week or so later, your body gets back down to neutral. What that means is before I go in there, I'm probably taking extra narcotics 3 or 4 times a day. That will bring it back down to not needing that breakthrough pain relief, maybe once a day at best. So that's why we do that, is so that your body can get a chance to start processing and using the painkillers for the reason that they're given to you. Because we do build up an immunity to it, we build up a tolerance to it. So what does that mean? That means that say you've got, for argument's sake, a very bad toothache, you will take a high dose of an opioid if that's what you need, and that will actually straight away relieve the pain. When you're a chronic pain sufferer, we do have acute episodes, and that is like if you have an onset of an injury, or you fall over, or you have a new pain source. That can be what they classified as acute. What's the difference between acute and chronic? Acute is an episode that will be resolved, but it can be quite intense, and hence the word acute. Like say you broke your leg, that is what they would call an acute episode. Chronic is, it doesn't stop. Chronic is ongoing pain. The fluctuations will be different, but it is pain nonetheless that is chronic, that has been there. I think the description or the definition is something that lasts longer than 3 months. So I think 29 years is actually a candidate to say chronic pain. How did I get diagnosed with some of these? When I was diagnosed with rheumatoid, it was triggered by the car accident I was talking about earlier. So the accident happened in the December, and October the next year, so I'd already given birth to my son, and so October the next year, I was having trouble with my hand. I couldn't, and that's a very typical thing that can happen in pregnancies and having a baby, is you get carpal tunnel syndrome. This was that and then some. And so the doctor did the usual things that he could do, and he said, I don't know, something else is going on. So it took about 6 months, lots of blood tests and going backwards and forwards for the diagnosis to come back of rheumatoid arthritis. So that means my rheumatoid factors were over 500. Everything was just out of whack. The only thing he could do is he put me into a chemo clinic and gave me 1,500 milligrams of prednisone through IV over a 4-hour period. And we needed to attack the rheumatoid and get it down to a management level, because I was in extreme pain then, and it was a very, very acute episode and a very significant episode, to the point that they ended up having to put me in hospital for a week because they just couldn't manage the pain. So that was the start of the roller coaster. And then I ended up having to have carpal tunnel surgery on both hands, shoulder surgery, and so on. So that was the onset of the start of helping my rheumatoid. So then years went by and I still started to have more symptoms, which is the fatigue and the I couldn't work, all these things. And then a lot of different things mounted up, and then the doctor said, I think you're suffering from fibromyalgia. I'd already at this stage been diagnosed with Sjogrens. That was part of the autoimmune disease. So my rheumatologist, by this stage I'd moved from Sydney to Queensland, and my Queensland rheumatologist said, I think that you've got fibromyalgia on top of your rheumatoid, which is not unusual for people to do that when your body is in a heightened state of pain for so long. Fibromyalgia tends to actually come to the party quite often. So then that being said, still going through all of the surgeries and operations. Oh, we're having a hailstorm. There's hail outside. I don't know if you can hear the rain. I might have to just go and check my car and I shall be back. I'm back. There's a storm outside. I thought I'd turn the lights on because it is crazy. Let me see if I can turn you away from the lights a bit. There we go. Put the lights behind us. So yes, so as I was saying, so then I was diagnosed with fibromyalgia, and that was something that we had to learn to deal with. I just banged my hand on the door. That's another thing too, people with chronic pain, as soon as you do what's classified, I don't know if you can see that, classified as a relatively small injury is not great for us. Anyway, I'll go back to where I was talking about. So, yep, I had lots of surgery, shoulders, knees, whatever. We ended up having to replace my hips, then we did my knees and so on. And my orthopedic surgeon, on my right knee, we just couldn't seem to get it to stop being painful. We didn't know what. It was artificial knee. He'd been in there and kept cleaning it out. And then he came back and he said, I think this is CRPS, complex regional pain syndrome. And that was probably, I'm going to have to say 4 or 5 years ago now. So he said, you've got it in both knees, not just one. One, as I said, one knee's been operated on 7 times, trying to fix it, clean it, get to the end, to the bottom of it and understand it. So when I was diagnosed with CRPS, I kind of just went, oh, okay, that makes sense. I've got pain in one area. Thought, that's okay. Little did I know what CRPS was, and if anybody out there that knows what this illness is, they call it the suicide disease for a very, very good reason. It's relentless. It's watching people go through it is horrendous. I think it's easier to be the patient than to watch someone suffer with this. It's where an acute episode of pain just doesn't stop. It's relentless. You'll notice in all my journals and all my things, I always put a pain score. The reason I do that, we need to see the fluctuations of my pain. When I'm getting those constant 8 and 9 scores, it means it's time for me to go in and have an infusion because I can't get enough medication on board to give me relief to just function like a normal person. I'll give you a classic example of a day in the life of someone that lives with CRPS. The other day I got a voucher for Christmas to go to this shop just to pick up some PJs. I've got a disabled parking, so I park the car. I've got probably 100 metres to walk, maybe at the most. So I go there, do my shopping, and I thought, I'd love to just browse and window shop and go in and out of shops and have a look around. By the time I got back to my car, I could hardly walk. I was in so much pain, I couldn't think. I'd had to drive home. And all I could do was get home, have a shower, and go to bed. And then all that was just wanted to go to a shop and go shopping. But I couldn't walk. I've got walking aids, I've got walking sticks, I've got walkers, I've got all of those aids, but just sometimes it's just the pain is so intense you don't have any choice but to rest. And that debilitating pain may actually last for a few hours, a few days. It could be just relentless. And that's what we live with. It isn't whether you're in pain or not, it's how much pain you're in. And you just have to learn to figure out how to live with it and how to just tolerate it. Sometimes it's so exhausting that you just can't think of what you can do to function. Sometimes you get brain fog. I get that all the time, where I know that I've got things I need to do, but like right now I'm sitting here and I'm really struggling to think that, okay, it's hurting just to sit here. But you just have to do it. You just have to keep going and keep doing what you've got to do. I do my planning and my journals, they're my therapy. They're what I use to distract my brain from thinking about what I'm going through. It helps me be creative. It brings me joy, which is why I do it. Talking to you guys also is a form of my therapy, because it's a chance to speak about this and spread awareness to other people. I think the hardest thing is for family members and friends, the amount of friends that I've lost over the time because they make arrangements to see you or to catch up, and you just can't get there. You just can't get out of bed. You just can't get dressed. The thought of actually walking to your car, driving, getting out of your car and going to wherever, whether it be a lunch or a dinner, and sitting there, you just can't do it. And so many people just got sick of inviting you that they just stop inviting you, and that's a real thing that does happen. Some family members don't believe you. They think you're a hypochondriac or you whatever, and they start dismissing you, or they'll start giving you these fabulous treatments that this worked for so-and-so, it'll work for you. I have tried thousands of different things, medications, diets, hypnotherapy, you name it, acupuncture, Chinese medicine, massage, all, physio, everything. I've tried everything. Of course, anyone that suffers from any sort of debilitating illness will try to help themselves. And at some point you just go, I can't take on board any more therapies. I can't do this anymore. I need to just live with what I have and understand this is where it is, and I'm just going to manage what I've got, which is where I'm at now. 29 years in is a long time. It's a long time to try and beat this beast, but you can't beat this beast. You just have to learn to understand, respect it. And what do I mean by that? What I mean is if like right now we've just had a storm which has really affected me, that's why I'm in a lot of pain, and understand the weather does affect me greatly, which is why you'll notice in my planners that I do track the weather. There's a reason for that. So I just have to be respectful of my body and the position that it's in and go, okay, the weather's not great for that week, so you shouldn't really be planning to do that, and that, which is what I have to do. And like I did the other day, where I thought I'd go and do some shopping, which anyone would normally want to do, browse around the shops. Anybody that knows me knows that's something that I'd love to do, but I just can't do that anymore. I guess the other thing I could do is hire a motorised scooter. Maybe that will work. But just be respectful of what your body is telling you. Today is not a good day. So today is a day that you actually have to do less strenuous tasks, whether that be, okay, I can't do the washing today because I'm not feeling great, or I can't plan to do this and this because I'm not feeling great, but tomorrow I might be, or in a few hours I might be. So that's what I mean by being respectful of your body and the position that you're currently in, and ask for help. When you need it, ask for it. If you can't, like I don't do a lot of the cooking because I can't stand in the kitchen for too long, but some days I love cooking, so I'll go and do it. And then I just have to go, yep, can't cook today, so I don't. I have to find another way. My partner cooks most of the time, so that's why I'm very lucky in that way. And I think one of the key messages, if I could give you, is ask for help. Don't be afraid to ask for help, because we're in this position. We didn't want to be in this position, but this is where we are. So I think I'll leave it there. I just wanted to give you an update because I haven't done one for a while and tell you where I'm at. I'm not great, but I'm still here. I've got lots of great things happening this year, so hopefully they will keep me going. Trying not to get emotional. Anyway, I just thought I would do this update for you all and tell you that you guys all mean the world to me, knowing that you're all watching my content and helping me get through it. I didn't realise I'd do this part. I might actually have to cut this part out. But anyway, if you're new here, I'm sorry you've had to put up with this part if you've stuck this long, but if you want to see more content, and I promise you there won't be a lot of content like this, this is just an update for those that want to know, and I'll bring you better stuff soon. But I think I better sign off now because I'm losing it. Anyway, ciao for now. Bye.